Welcome to my YouTube channel, Homeopathy Super Sessions by Dr. Jacos. Today I'll be doing the last part of the part 3 of Robert's chapter 29, Disease Classification, Psychosis. So in the part 2, we had seen that when the rheumatic complaints are suppressed, the disease travels from the less important organs to the more important organs, and the heart is involved. So we go further. The cardiac valvular lesions are due to the combination of psychosis and psora. The valves change in the organic structure, which may be fatal to the patient. So basically, Robert is of the opinion that when rheumatism is suppressed, the heart is involved, the heart valves are involved, you get rheumatic heart disease, and it's a combination of the miasm, psychosis, and psora. And since the valves, the organic structure is there in the valves, it may be dangerous or even life-threatening condition to the patient, and the patient may also die. Well, there is no fear and apprehension that we find in the psoric patient. So if in the psychotic miasm, we do not get any fear or we do not get any worries or apprehension about the disease which the patient has. We'll only find it if the psoric taint is there in the patient. So in the psoric patient, the patient gets worried about his condition. He takes his pulse frequently. He fears death and remains quiet. So if the psoric trait is predominant in the patient, or if the psoric miasm is predominant in the patient, and the patient is getting some complaints of the heart, generally psoric complaints are functional. He may just get some palpitations or tachycardia because of some excessive hyperanxiety or worries or tension, but there is no structural alteration in the heart as we get in psychosis, where the valves are involved and there's a structural change in the valves which may also be fatal. So if in the psoric patient we generally get functional disturbances, and if the heart is involved, again, there's also functional disturbances, and patient is very much worried. He will take the pulse frequently. He will wonder whether his heart is beating properly or not, and he fears death, but he remains quiet. In syphilitic and psychotic patients, they have no mental distress, whereas Roberts is of the opinion that if the syphilitic and in a syphilitic or a psychotic patient, if the heart has been involved, then they do not have any mental distress and may not have any subjective heart symptoms, but they die suddenly and without warning. So this is another important point, that in a heart patient, if there is a syphilitic or psychotic stigma, then basically there will be no mental distress as we seen in the psoric patient, but they will suddenly die without any warning. If there are pains about the heart and dyspnea, these conditions are better from gentle exercise as slow walking or riding. So better by slow motion or better by gentle motion or gentle exercise is another important modality of the psychotic miasm. As the rule, these patients are fleshy and puffy. Their obesity is the cause of the dyspnea. So their constitution, basically, as you all know, the psychotic constitution, patients are short-statured, they have a pot-belly abdomen, they have a broad, flat nose, well-marked linea nasalis, so on and so forth. So Robert says that he's given importance to the obesity, that the patients are fleshy, they are puffy, maybe a bit associated with anemia, and the main cause of their dyspnea is overweight or obesity. Frequently, the face becomes bluish and cyanotic, sometimes with venous congestion. So Robert says that also this may be seen, especially if you equate it with temper tantrums in small children, this becomes very prominent. Anasarca may be present, which is aggravated by high living, rich spicy food, or intake of spiritual liquors. Now, cravings. So each miasm has its own craving, which you must remember. So in psychotic miasm, you have craving for nuts, beans, cheese, and beer. Beer causes much less aggravation as compared to the intake of wine. So aversion to meat also is aversion to meat as it disagrees and they cannot digest it. So the patient also has an aversion to meat, cannot tolerate beer as well as wine. But the aggravation from beer is much less as compared to that of wine. So you have to remember these cravings. You have to mug it up. Craving for nuts, beans, cheese, and beer. Aversion to meat and beer disagrees. Even wine disagrees. Now, the GIT symptoms are generally aggravated by eating any food and better by lying on the stomach or by pressure. This is also another important modality of the psychotic miasm. And the pains are always colicky in nature. Now, each miasm has a different type of pain. So, in the psychosis or in the psychotic miasm, we have got colicky type of pain, intermittent colicky type of pain, which comes and goes, So, this intermittent colicky type of pain can be seen in any tubular organ. Okay, it could be the uterus causing dysmenorrhea. It could be the coronary arteries causing angina. It could be in the intestines causing intestinal colic or abdominal colic. And the patient is better by double bending and hard pressure. So please remember, the psychotic pains are always colicky in nature and they are intermittent, occurring in all hollow organs. And also you need to remember, in psychotic miasm, there is always vasoconstriction in all the hollowed organs. So vasoconstriction in the intestines you get, vasoconstriction in the uterus you get, vasoconstrictions you get in the bronchi, bronchioles, in the coronary arteries. So all this will lead to the vasoconstriction and intermittent type of pain. Diarrhea are always preceded and accompanied by colic, griping, and tenesmus. So whenever there's diarrhea, naturally there will be severe intestinal colic, in which you get a colicky type of pain or griping pain with severe tenesmus. Again, the modalities remain the same. Better by lying on the abdomen, better by hard pressure, better by double bending. The stools are gushing and they're ejaculated forcibly. Marked irritability is always marked, whether be it in diarrhea, hemorrhoids, or any other digestive manifestation. So again, irritability could be an important concomitant of the psychotic miasm according to Roberts. In the psoric miasm, you're getting an important concomitant of weakness, that everything is accompanied by weakness in the psoric miasm. In the psychotic miasm, Robert is of the opinion that irritability is marked with any condition, whether it could be diarrhea, hemorrhoids, or any other digestive manifestation. Now, the psychotic child is sour smelling. So, as you all know, the discharges are green or greenish yellow in color, having a fish brine odor, or even sour smelling discharges. He wants constant attention. So the child is very attention seeking. If he doesn't get what he wants, there'll be temper tantrums. He will shout, he will yell, he will roll on the floor, he will bang his head against the wall, and will create a ruckus so as to gain attention. He must be rocked or carried. So better by being carried or better by being rocked. Ear colics are from better by lying on the abdomen and better from pressure. In the urinary tract symptoms, there is intense pain on urination. The child screams from the pain. This is due to spasmodic contraction affecting the urethra. So as I told you, all the hollowed organs are affected by the spasmodic, colicky, intermittent type of pain. So out here, in the urinary tract also, you get intense pain because of spasmodic contraction affecting the urethra, as a result of which the child screams from pain. Many diseases of the urinary tract are multi-miasmatic, combined with syphilis, psora, and psychosis, with the last two components more prominent. So as you all know, that all the diseases are multi-miasmatic, only one being prominent at a point in time. Similarly, all the drugs are also multi-miasmatic, one being prominent at a point in time. So also out here, that Roberts is of the opinion that many diseases of the urinary tract are multi-miasmatic, combined with the psora, psychosis, and syphilis, but psora and psychosis become more prominent. The diabetic patient is usually strongly tubercular. So Robert has the opinion that the diabetic patient will have the tubercular miasm or strongly tubercular trait will be there. That is a combination of the psoric miasm and the syphilitic miasm. So as you all know, tubercular miasm was invented by Dr. J.H. Allen. But if there's a psychotic taint as well, the condition becomes more malignant. So therefore, he says that whenever in a tubercular background, whenever psychotic taint is there, then the condition becomes more malignant. Bright disease is a manifestation of all three stigmata combined. So he says that Bright's disease is a manifestation of all the stigma of all the miasm, that is psora, syphilis, and psychosis. We find fibrous changes, we may be sure that there's a strong psychotic influence. So wherever there are fibrous changes occurring, then Robert says that be sure that there is a strong psychotic influence. When the psychotic stigma is combined with the tubercular trait, there's a tendency to become more malignant, which I've just told you. Example, in the rectum, we find many conditions of tubercular origin like strictures, fistula, sinuses, and pockets. So these are the examples which are tubercular origin, like fistula, sinus, and even strictures, what he has said. But generally, strictures will be psychotic, but this is Robert's view on it. But when there's an addition of psychotic stigma, the conditions are greatly aggravated. So along with this tubercular origin, when the psychotic stigma is there, so in addition of the psychotic stigma, the conditions are greatly aggravated. So the piles aggravated, the fistula is aggravated, the sinuses are aggravated, etc. There is much more tendency towards malignancy for combination of tubercular diathesis with psychosis produces cancerous affections. The most frequent location of psychotic manifestation in women is in the pelvic organs. Now, pelvic inflammation, such as inflammation of the ovaries, inflammatory disease of the female pelvis, may be traced to this trait. So, very important point also with Robert again, he tells you that the psychotic manifestations in the pelvic organs of the woman is very important, in which you get inflammation of the ovaries and inflammation of the female genital tract. In more chronic types, we get cystic degeneration of the ovaries, the uterus, and fallopian tubes. So initially, there may just be an inflammation, but if the disease is more chronic, then there will be cyst formation in either the ovaries, the uterus, or the fallopian tubes. As I told you again, cystic formation or cyst formation, again, is a psychotic trait. Again, the infection may pass into the peritoneal cavity, and we find general peritonitis and general cellulitis. So from the pelvic organs, the infection may go to the peritoneum, and we get generalized peritonitis and cellulitis. Appendicitis is directly traceable to the psychotic influence. So because of that, even the appendix may get inflamed. So therefore, he says appendicitis is directly traceable to the psychotic influence, because the infection may pass from the peritoneal cavity, and we find inflammation of the appendix also. Just to recap, the psychotic manifestations in the abdomen have colicky, spasmodic, and often paroxysmal pain of psychosis, which I have told you in the previous part. The discharges are acrid, which corrode the skin. Odor of discharges of a stale fish or fish brine-like odor, and the mucous membranes have a mottled appearance. It is very common to suppress the discharge in day-to-day medical practice. Thus, if the psychotic discharge is suppressed, then the disease travels with great rapidity. So, if the discharges are suppressed, the disease becomes more active, it becomes more vulnerable to go into the deeper organs, and the disease travels from the less important organs to the more important organs. The disease that goes from periphery to center, or travels to the more deeper vital organs. There will be a sudden flaring up of the difficulty, and the death will very soon ensure. So if the disease if the discharges have been suppressed, then the disease goes more deeper into the organism, and you will get sudden acute exacerbation of flaring up of the disease, and even death will also ensure. The gonorrheal poison in its chronic state has the rheumatic conditions. As Robert has told you before also, and I've told you also in the part 2, that the rheumatic complaints or the psychosis will affect the joints or the rheumatic complaints, which are of great importance. These are pains in the small joints with infiltrations and deposits. So gouty conditions in which you get pain in the small joints with infiltrations and deposits of uric acid. Stiffness, soreness, and lameness are characteristic of this stigma. So in the joints, you'll be getting stiffness of the joints, or sore, lame, bruised feeling, or lameness of the joints will be characteristic. Thus, there are tearing pains in the joints, which are aggravated during rest, during cold, damp weather. As I told you, with the hereditary constitution, the patient cannot tolerate wet or rainy weather, and better by moving or stretching, and better in the dry weather, or better by moving slowly, by gentle motion. The gouty diathesis has a psychotic base. The psychotic skin manifestation tend towards overgrowth or extra deposits. So in the skin manifestations, you will have overgrowths or extra deposits. The nails are ribbed or ridged and thick and heavy. So the nails, also you could see ridges on the nails or longitudinal ridges on the nails. Nails are very thick and they're very discolored also. You may also get moles, warts, wine color patches, and other manifestations of unnaturally thickened skin belonging to this classification. So you get not only overgrowths like moles, warts, papilloma, but you also get unnatural thickened skin. So lichenification is also another important feature of the psychotic miasm. This is especially in chronic complaints. Skin eruptions of the stigma occur in circumscribed spots, and they are exfoliating eczema. So if eczema is there, they'll be exfoliating, and skin eruptions generally are circumscribed. They occur in the circumscribed spots. Psoriasis is a combination of the three stigmata, with psychosis and psora predominating. So Roberts is of the opinion that psora has all the three miasms, but psychosis and psora are more predominating. There is dryness of psora. So in psoriasis, you get the dryness of the psora, the squamous character of syphilis, and the overgrowth of tissue or the thickened skin or manifestation of psychosis. In herpes zoster, malignancy of the skin and barbers each develop in a psychotic patient when there's underlying psychotic trait. Stitch abscess will never occur until there is a psychotic tendency in the patient. So that's all for this chapter, and that's all as the end of part 3. So I hope you all like this video of mine, which was divided into 3 parts. So please do be tuned for more videos, and please do subscribe to my channel, Homoeopathy Supersessions by Dr. Jacos. Thank you very much.